Over 65? This pill is damaging the hearts of older adults. Senior health tips. There's a startling reality that millions of seniors face, a silent threat lurking in their medicine cabinets, often taken without a second thought. This isn't about a new experimental drug. It's about common medications prescribed by trusted doctors that are slowly and in many cases irreversibly destroying hearts. I am Dr. Claire Whitmore, and after dedicating 2 decades of my life to cardiac surgery, I have witnessed firsthand the devastating consequences of these medications. I've held hearts in my hands that were once healthy, functioning perfectly, only to find them ravaged by drugs prescribed to manage other health conditions. The most terrifying aspect of this is the consistent response I receive when questioning patients. My doctor said it was safe. My doctor said I needed it. My doctor never mentioned it would harm my heart. This pervasive lack of awareness, this failure in communication, is what fuels my urgency to share this vital information. I will not reveal the specific medications immediately, as I understand the immediate reaction would be to check your own medicine cabinet and stop watching if you don't recognize the name. However, this is a critical oversight, as there are not 1, but 7 common medications that pose this grave risk to seniors, all acting through different yet equally destructive mechanisms. Before I disclose the names of these medications, it is imperative that you understand the silent, insidious damage they inflict. Consider the case of William, a 72-year-old retired postal worker. By all accounts, William was the picture of health: a non-smoker, moderate drinker, maintaining a healthy weight, and exercising regularly. His only ailment was severe arthritis in his knees, a condition that made every step a painful ordeal, transforming simple acts like getting out of bed or walking to the mailbox into significant challenges. His doctor, aiming to improve his mobility and quality of life, prescribed a common medication, one advertised widely on television and taken by an estimated 60 million Americans. This medication, taken diligently twice a day for 3 years, did indeed alleviate William's knee pain, allowing him to garden again and spend quality time with his grandchildren. However, a silent war was being waged within his chest. Unbeknownst to William or his physician, this seemingly benign pill was forcing his heart to work overtime with every beat. His blood vessels began to constrict, his blood pressure subtly increased, and his kidneys started retaining fluid. His heart, a remarkable organ capable of adaptation, initially compensated for this increased workload. But like any engine pushed beyond its limits, there's a breaking point. William's heart was steadily approaching this point, an unseen deterioration accumulating with each passing dose. The first subtle sign was a generalized fatigue, a feeling of breathlessness after climbing his driveway, which William attributed to the natural progression of aging. This seemingly minor symptom went unmentioned to his doctor, dismissed as a normal part of getting older. Yet, it was the harbinger of a failing heart. The muscle was weakening, its pumping efficiency diminishing, irreversible changes commencing within the heart tissue. Soon, William found himself waking up multiple times a night, needing to sleep propped up on 2 pillows, as lying flat made him feel as though he was struggling to breathe, experiencing a heavy sensation on his chest, as if he were drowning. He'd wake gasping for air, waiting for the feeling to subside. This disrupted sleep left him perpetually exhausted, yet he never connected these symptoms to his heart, assuming it might be sleep apnea or acid reflux. The idea that a medication for knee pain could be harming his heart seemed far-fetched. However, the reality was dire. William's heart was becoming engorged with fluid. His weakened muscle was no longer efficiently pumping blood forward, causing it to back up into his lungs. Fluid began to leak from his blood vessels into the lung tissue. Each night, as he lay flat, gravity exacerbated this fluid buildup, effectively causing him to drown in his own bodily fluids. The very medication meant to alleviate his pain was compounding the problem, forcing his heart to work against increased resistance, retaining more sodium and fluid, pushing his compromised heart closer to complete collapse. This tragic descent occurred without anyone's awareness, without any monitoring of his cardiac function, simply because the connection between knee pain medication and heart destruction was not considered. The day that irrevocably changed William's life began like any other Saturday. While working on his car in the garage, he stood up and was overcome by dizziness. He sat on his workbench, hoping it would pass, but the dizziness intensified, his vision narrowing until only a tunnel remained. He attempted to call out to his wife, but no sound emerged. His wife found him slumped over, unconscious. Emergency services were called, and upon their arrival, paramedics found his blood pressure dangerously low and his oxygen saturation critically diminished. His lungs were visibly congested with fluid, emitting crackling sounds with each labored breath, the unmistakable sounds of drowning. He was rushed to the hospital, where an X-ray confirmed severe heart failure. His heart's ejection fraction, a measure of its pumping efficiency, was a mere 25%, a stark contrast to the healthy range of 55 to 60%. The echocardiogram revealed a severely enlarged, dilated, and scarred heart muscle, a testament to years of cumulative damage. The cardiologist explained to William's wife that his heart was essentially destroyed. The most heart-wrenching moment came when the cardiologist, reviewing William's medications, inquired about his arthritis treatment. Upon learning that William had been taking it for 3 years, the doctor closed his eyes and expressed his dismay, stating that this medication was known to cause heart failure, carrying black box warnings, and that William should never have been on it for so long. His wife's heartbroken sobs echoed the devastating realization that her husband's heart had been destroyed by a prescribed medication, a fact that had remained hidden until this catastrophic event. This scenario, sadly, is not an isolated incident. It represents a systemic failure within the medical community, where medications are frequently prescribed without adequate consideration for their potential cardiac side effects, without proper monitoring, and crucially, without informing patients of the risks. The truly infuriating aspect of William's case is that his debilitating arthritis had numerous safer treatment alternatives. Options like acetaminophen, topical creams, physical therapy, and cortisone injections, all of which would have spared his heart. Yet the path of least resistance, the most profitable option for drug manufacturers, the easiest prescription for doctors to write, was chosen, leading to William's profound and irreversible heart damage. Now, at 75, William lives with severe heart failure, reliant on 7 cardiac medications, his mobility severely restricted, unable to engage in activities he once cherished. His garage, once a hub of his hobbies, stands empty, a stark reminder of his lost energy and vitality. His grandchildren visit, but he lacks the strength to play with them, barely able to stay awake for their presence. His life has been reduced to a constant struggle for breath, punctuated by hospitalizations, as heart failure is a progressive and incurable condition. The extent of his heart damage has rendered him ineligible for a transplant, a cruel irony given his previously healthy lifestyle. Each day he laments, "Why didn't anyone tell me? Why didn't my doctor warn me? I would have endured the knee pain. I would have done anything to avoid this. This inability to breathe, this nightly feeling of drowning, this imprisonment in a body that has failed me." William's story is a stark illustration of how a single prescribed medication can dismantle a life. He was once healthy, active, and independent, living a fulfilling existence. Now that life has been irrevocably altered. This isn't an anomaly. It's a reality for thousands of seniors who are currently experiencing similar devastation. The medication that led to William's heart failure is widely recognized, likely present in a significant percentage of American households, potentially impacting 4 out of every 10 seniors over 65. Their hearts are silently deteriorating, their conditions progressing without discernible symptoms until a catastrophic event occurs. This is just the first of 7 critical medications that I must expose. Each of these 7 drugs, commonly prescribed and routinely administered, carries the potential to destroy hearts in seniors, often through distinct pathways. Before delving into the next case, it's crucial to understand a fundamental physiological principle that amplifies the danger of these medications in older adults: the loss of cardiac reserve. As we age, our hearts, much like a car engine, lose their reserve capacity. A younger heart can operate at a fraction of its potential, possessing a significant buffer. However, by the age of 70, most seniors are already utilizing close to 90% of their heart's capacity for normal daily activities, leaving little to no reserve. When a medication, even one that demands a mere 10 to 15% increase in cardiac workload, is introduced, the heart has no extra capacity to draw upon. This forces it to exceed its 100% limit, leading to immediate and catastrophic failure. William's heart, at 72, was operating at this extreme capacity. The medication's demand for an additional 15% workload meant his heart needed 105% of its capacity, an impossibility. The muscle stretched, dilated, weakened, and suffered permanent damage. This same precarious balance is being tipped for millions of seniors, their hearts stretched to their absolute limit, one prescription away from William's fate. Now, let us turn to Dorothy, a 68-year-old woman whose story illustrates a more aggressive form of cardiac destruction. Dorothy had mild high blood pressure, a reading of 142/88, which her doctor deemed necessary to control, emphasizing the dangers of uncontrolled hypertension. The prescribed medication, a common blood pressure drug widely used across the nation, successfully lowered her readings to an optimal 128/78. Dorothy, diligently following her doctor's orders, felt she was doing everything right to maintain her health. Unseen. However, an insidious process was unfolding within her heart. The medication directly impacted her heart muscle by blocking calcium channels, essential for its contraction. This blockade led to weakened contractions and, over months and years, caused her heart cells to die. These dead cells were replaced by non-functional scar tissue, creating dead zones within her heart. After 4 years of this gradual destruction, Dorothy began experiencing extreme fatigue, a symptom she attributed to her age. Blood tests revealed no underlying issues, and she was advised to exercise more, an endeavor that only worsened her condition, leaving her breathless and her heart pounding. Dorothy's heart was failing. The accumulated damage from the calcium channel blocker had so severely compromised the remaining muscle that it could no longer sustain adequate blood flow to her body. Her organs were essentially starving for oxygen. The turning point came during a routine trip to the grocery store. A strange fluttering sensation in her chest escalated into a rapid, irregular heartbeat. Feeling lightheaded and dizzy, she grabbed a shelf for support, but before she could cry for help, she collapsed, losing consciousness. Paramedics arriving on the scene found her in a state of extreme cardiac distress, her heart rate alarmingly high and erratic. At the hospital, an echocardiogram revealed a severely damaged left ventricle, its walls thin and stretched, with significant areas of non-contractile scar tissue. Her ejection fraction was a mere 30%, indicating less than half of her heart's normal pumping capacity. The cardiologist explained to Dorothy and her daughter that she had severe dilated cardiomyopathy, caused by the long-term use of her blood pressure medication. Dorothy was devastated, recalling her doctor never once mentioning the potential for cardiac damage, only assuring her of the medication's safety. The cardiologist acknowledged that while the medication is safe for most, a subset of patients, particularly older adults, are susceptible to this devastating side effect, a susceptibility that often goes undetected until the damage is severe. He noted the absence of any cardiac monitoring throughout her 4 years on the medication. Now, Dorothy's heart is permanently damaged. The scar tissue will never regenerate into functional muscle. Despite discontinuing the offending medication, the damage is irreversible. At 68, her heart function mirrors that of someone in end-stage heart failure, making her ineligible for a transplant. She faces a future of severe heart failure, her life a constant struggle to perform even the simplest activities. The medication that caused this destruction, a drug still prescribed to countless seniors, continues to inflict similar damage due to a lack of monitoring and patient education. Dorothy sought treatment for mild hypertension, a condition that could have been managed through lifestyle changes or safer medications. Instead, she received a drug that irrevocably harmed her heart, stole her independence, and diminished her quality of life, all for a modest reduction in blood pressure. This tragic trade-off, a treatment worse than the disease, is a recurring theme, driven by a medical system that often prioritizes convenience and profit over comprehensive risk assessment and patient well-being. It's crucial to understand that these medications are not universally harmful. Many individuals tolerate them without adverse effects. However, a significant portion of the population, particularly seniors, exhibits a heightened susceptibility, leading to severe and irreversible heart damage. This disparity underscores the critical need for proactive cardiac monitoring, a practice that is conspicuously absent in many cases. Doctors, it seems, often prescribe and forget, leaving patients vulnerable to silent deterioration. The anxiety you might be feeling is warranted if you are over 65 and taking any medications for blood pressure, pain, diabetes, or heart conditions. There's a tangible risk they are actively harming your heart, a risk you may not discover until it's too late. But I promise to provide you with the specific information you need to protect yourself. Let's consider James, a 76-year-old man who suffered from severe acid reflux, experiencing nightly heartburn and discomfort that disrupted his sleep and quality of life. His doctor prescribed a proton pump inhibitor, PPI, a common medication designed to reduce stomach acid. The PPI provided immediate relief, eliminating James's heartburn and allowing him to sleep soundly. For 8 years, James faithfully took this medication every morning. However, a critical consequence of blocking stomach acid long-term is the inhibition of magnesium absorption. Magnesium is vital for maintaining a stable heart rhythm, and its depletion can lead to electrical instability and chaotic heartbeats. For 8 years, James's magnesium levels plummeted unnoticed, as no doctor monitored them. Eventually, his magnesium reached a critical low, destabilizing his heart rhythm. One evening, James experienced a sudden onset of rapid, irregular heart palpitations, a sensation he described as a fish flopping around inside his rib cage. He became dizzy and lost consciousness. Paramedics identified atrial fibrillation, AFib, a dangerous irregular heartbeat, and rushed him to the hospital. Despite immediate treatment, his AFib persisted, a testament to the lasting damage caused by prolonged magnesium deficiency. The cardiologist, puzzled by James's lack of risk factors for AFib, discovered his critically low magnesium level, directly linked to his 8 years of PPI use. Although the PPI was stopped and magnesium supplementation initiated, the AFib became permanent. James, now 80, lives with permanent AFib, requiring lifelong blood thinners and facing an elevated risk of stroke and heart failure. His condition arose from a medication taken for 8 years to treat heartburn, a condition that could have been managed with simpler, safer methods like dietary changes or occasional antacids. The PPI, intended for short-term use, was prescribed indefinitely, leading to James's chronic heart rhythm disorder. This scenario highlights a broader issue: the routine long-term prescription of PPIs for millions of seniors, silently depleting their magnesium and increasing their risk of AFib and stroke. We have now discussed 3 distinct scenarios: William's heart failure due to pain medication, Dorothy's heart muscle damage from blood pressure medication, and James's permanent AFib from reflux medication. Each case involves commonly prescribed drugs with different mechanisms of cardiac destruction, all stemming from a failure to monitor, warn, or consider the specific vulnerabilities of seniors. The frustration you feel is understandable, and I will soon reveal the names of these dangerous medications. But first, you must grasp the systemic reason behind these failures. Drug trials rarely include a significant number of elderly participants. Medications are tested on younger, healthier individuals, and their safety is extrapolated to older populations who have multiple health issues and take multiple drugs. This lack of age-specific research means that long-term side effects, like magnesium depletion or cardiomyopathy, often go undetected until after widespread prescription and significant harm has occurred. Here are the 7 medications that pose a significant risk to the hearts of seniors. Pay close attention, as this information could be life-saving. 1. NSAIDs, non-steroidal anti-inflammatory drugs. This category includes commonly used medications like ibuprofen, naproxen, and diclofenac. These drugs, prescribed for conditions like arthritis, can cause fluid retention, elevate blood pressure, and increase the heart's workload, leading to heart failure. Despite black box warnings, they remain a go-to for pain management in seniors. Safer alternatives like acetaminophen, topical creams, or physical therapy should be prioritized. 2. Certain calcium channel blockers, specifically diltiazem and verapamil. These medications, used to manage blood pressure, can weaken heart muscle contractions and, in susceptible individuals, particularly over time and with long-term use, lead to dilated cardiomyopathy. While other safer blood pressure medications exist, these are still frequently prescribed first line. Proton pump inhibitors, PPIs. Medications like omeprazole, pantoprazole, and lansoprazole, prescribed for acid reflux, are intended for short-term use, 4 to 8 weeks. However, millions of seniors take them for years, leading to significant magnesium depletion, which can cause dangerous heart rhythm abnormalities like atrial fibrillation. H2 blockers, dietary changes, and as-needed antacids are safer long-term strategies. 4. Thiazolidinediones, TZDs. These diabetes medications, including pioglitazone and rosiglitazone, can cause fluid retention and worsen heart failure, especially in seniors and those with pre-existing heart conditions. Safer diabetes medications like metformin, GLP-1 agonists, and SGLT2 inhibitors are available and often protect the heart. Certain tricyclic antidepressants, TCAs. Medications like amitriptyline and doxepin can affect heart rhythm, prolonging the QT interval and increasing the risk of dangerous arrhythmias in seniors, particularly when combined with other QT prolonging drugs. Newer antidepressants like SSRIs and SNRIs generally have a safer cardiac profile. 6. This medication is prescribed to prevent atrial fibrillation, yet ironically, it can cause heart failure, worsen existing heart failure, and has led to fatalities. It carries black box warnings and should not be used in patients with heart failure, but it is sometimes prescribed regardless. 7. NSAIDs. Again, I am listing NSAIDs a second time because their danger is so pervasive and their use so common. Many people underestimate the risks of over-the-counter NSAIDs, viewing them as harmless. However, their potential to cause heart failure, stroke, and kidney failure is significant and deadly. It is imperative that you do not stop taking any of these medications abruptly. Some require a gradual tapering process under medical supervision to avoid rebound effects or withdrawal. However, you can take immediate action. Compile a complete list of every medication and supplement you are taking, and schedule a consultation with your doctor. Inquire specifically about the cardiac risks associated with each medication, explore safer alternatives, and discuss whether all current prescriptions are still necessary. If your doctor is dismissive or defensive, seek a second opinion from a physician who prioritizes your heart health. Consider joining online communities where seniors have successfully reviewed their medications, switched to safer options, and experienced significant health improvements. For example, many have found relief from heart failure symptoms by discontinuing NSAIDs or improved heart function by switching from diltiazem to safer alternatives. The information I will share next week will detail essential blood tests for monitoring if you are on any of these medications, along with early warning signs of cardiac damage that can predict heart failure before symptoms become severe. Subscribe to ensure you don't miss this crucial information. Share this video widely with anyone over 65, those taking multiple medications, and anyone who places blind trust in their doctor. Doctors are human. They make mistakes, overlook details, and adhere to outdated protocols. It is your responsibility to become an advocate for your own health. Question every prescription, demand justification, inquire about alternatives, and insist on regular monitoring. Your heart is an irreplaceable organ, and once damaged, it rarely recovers fully. Protect it by being informed, assertive, and proactive. Thank you for watching. Review your medications today, join the community, and subscribe for the vital monitoring protocols that can help you safeguard your heart before it's too late.